Hi everybody, I'm Clair Mills and I'm the Medical Director of MSF in Paris. As everyone knows, the situation in Europe is very challenging at the moment, and certainly the health system is under a lot of stress, particularly in France, Italy, but increasingly in other countries as well. This means that for MSF it's an extremely challenging time. Many of our staff who would normally be going to the field or supporting the field are working in French hospitals, for example. It also means that supplies and other things that are really important to maintaining our projects and to being able to respond to coronavirus in our missions in Africa, in Asia and other parts of the world are very challenging at the moment. Our major concerns are firstly to protect our staff, because we cannot respond if our staff are not safe. Secondly, we want to support the authorities in all the places we work to carry out the important measures of social distancing, that is keeping people safely apart so that we can prevent the spread of this virus. And then thirdly, it's really important that we have the capacity to respond and to look after people and to be able to treat them. The last thing is we realise that there's a lot of social and economic consequences of this crisis which are unfolding, and that is something that concerns us as well. I think at this stage of the pandemic, all countries are at risk. I think we cannot ignore the fact that this is a global issue now. Of course, countries that have already managed many cases, like China and South Korea, have showed us what's important to do. And that's really important that we all understand this. I think 6 weeks ago, many of us in France would have thought it completely insane that the government asked us all to stay home. But this is incredibly important, and I think that for countries who have not yet taken those measures, they're likely to come, and it's really important that as MSF we support that, and we support our staff in doing that. In MSF we work in many places where the health system is very fragile, where there already are not enough staff, enough resources, where people often have problems of access, particularly where there's conflicts or crises like Afghanistan, like Iran, like much of the Middle East, like Burkina Faso. So these are places where we're really trying very hard to ensure that our operations can keep going to treat the diseases that are already killing people, but also that we can help the response in those countries, and we will be a part of that bigger response to support the necessary measures, both in terms of prevention, but also in terms of treatment of the virus. There are a number of big challenges for us. Firstly, the travel restrictions mean that the way we normally operate, sending international staff all around the world, is very difficult. And part of that is because we are not very sure that we are going to be able to bring people back if they need to come back to their homes. We of course will do our best. The second thing is that the supply chain is really problematic, particularly for things like masks, gowns, gloves and other important equipment such as oxygen concentrators. This means that we are asking people to be really sensible about the use of protective gear, that as per the WHO and MSF recommendations, that you don't wear a mask if you're fit and well. We really need to save those for our health staff when they really need them. We are working on all the possible supply options with the supply centres in Europe, and we're also asking each mission to look at options for local or regional purchase, because we know that this is going to be a big problem for the coming months. When you think about the communities that we work with anywhere in the world, there are people with particular vulnerabilities to this virus, and that is obviously people with medical conditions such as diabetes or high blood pressure or heart disease, people who are already under treatment for these kind of conditions, but also just by the nature of the context we work, people are very vulnerable because they often don't have good access to care, because they may be affected economically in a very severe way by this crisis. So it's difficult to say who is the most vulnerable. I think sometimes probably most people are going to feel vulnerable at some point, but we particularly need to focus on people in our context who really need us at this time. One of the populations we need to think about in particular is people who live in close proximity to each other, and that includes places like refugee camps. Obviously, it also applies to many of the big urban areas that we work in. This means that we need to be really trying to inform people in a very calm and sensible way about the precautions they need to take. And of course, it's very simple things. Hand washing. That becomes more difficult if you don't have good access to water, of course. But these are the things that each of our missions is being asked to look at. This is a new virus, and there are many researchers working round the clock on developing a new vaccine. There are already some initial studies underway. We are very hopeful that a vaccine will be found, but it will be at least a year, most people think, before there will be production in any volume that will be useful for us. And so we can't depend on a vaccine right now. We really have to depend on the measures that are important to reduce the transmission of any virus, like a flu virus. So that means keeping a distance from people, making sure that the people around you who have got medical conditions can keep away safely at home and be looked after. Making sure that you wash your hands regularly. And of course, it's really important at this time because there's many people that have anxiety and stress, that we talk to each other, virtually of course now for many of us, but that we keep in contact with people, that we look out for our neighbours, that we look out for our colleagues. And I think we have to give an enormous thanks of the contributions that all our staff in the health services that we run are making, because these are the people that we really depend on. So MSF is already supporting in Italy a hospital and has some other projects in development. We are looking at trying to mount a project in Iran, where obviously there's a sizable number of cases now. We are also supporting the authorities in Afghanistan based around our project in Herat, which is very close to the Iranian border. In all our projects, we are preparing to manage this epidemic. At this point, in many places without local transmission, we're trying to ensure that there's good preparation, that we're part of the overall approach to this epidemic in the country, that we support the social measures that are needed to take place, and that we ensure the protection of our staff. I think for people in Europe and in France in particular, there are still many ways you can help. Firstly, none of the work that MSF does can be done without the support of you, our donors and our friends. Secondly, I think it's important to keep a sense of perspective. We know that the health systems in Europe are really under pressure. This is why we're all being asked to stay home. But please remember that in many parts of the world, health systems are even more fragile and less able to cope. So I think in our sense of global solidarity, it's really important to remember this. Lastly, if you are a health worker or logistician and have previous MSF experience and want to support either missions in Europe or overseas, please contact recruitment. I think in these really challenging times when people are often stressed and anxious, where people are worried about their incomes, about their families, about people far away from them, and there's a lot of unknown factors, it's really very important to look after each other. And the sense of solidarity, the sense of the fact that we're all in this together is really important to keep hold of. MSF's priority right now is to protect our staff, to maintain the operations where there's not much transmission yet, but to be able to respond, to make sure that we are able to support local authorities to carry out social measures to prevent this epidemic spreading further, but also to be able to treat patients.